in our series. For those who don't know me, I'm Yvette Cozier. I'm an associate professor of epidemiology and the assistant dean of diversity and inclusion at the School of Public Health. This fall marks the third year of our One School, One Book program, SPH Reads, hosted by the Office of Diversity and Inclusion. The goal of this program is to encourage critical thought and discussion among all members of the community, centered on a carefully chosen, thought-provoking book. This year's selection is Evicted, Poverty and Profit in the American City, the 2017 Pulitzer Prize winning book by sociologist and MacArthur Genius Award winner Matthew Desmond. This book explores the stories of tenants and landlords in the poorest areas of Milwaukee from 2008 to 2009. In those communities, families spend most of their income on housing, and eviction is a routine, vicious cycle. Desmond shows us how the process of eviction undermines self, family, and community, bearing down disproportionately on women with children. Hailed as wrenching and revelatory, vivid and unsettling, Evicted transforms our understanding of poverty and economic exploitation while reminding us of the centrality of home, without which nothing else, including good health, is possible. The process of eviction is not limited to other places. In the city of Boston, we have a booming tech industry, a hot real estate market, growth of new high-end communities, Airbnb opportunities, and too few affordable housing opportunities. All of these have converged to destabilize previously overlooked neighborhoods by increasing rents at a pace that fewer and fewer families can maintain. It's within this lens that we will have today's discussion. So today we are joined by a distinguished panel representing executive, legislative, legal, and medical expertise. We will discuss the impact of housing instability and eviction on our city. Our guests today are Sheila Dillon, Chief of Housing and Director of Neighborhood and Development for the City of Boston; Johanna Flax, Legal Director of the MLPB, the founding Medical Legal Partnership Program; Honorable Byron Rushing, Mass State Representative of the 9th Suffolk District, which includes the South End; and Dr. Megan Sandell, Associate Director of the Grow Clinic at Boston Medical Center and Associate Professor at BU Schools of Medicine and Public Health. Today's discussion will be moderated by Dr. Jennifer Baird, Clinical Associate Professor in the Department of Global Health at Boston University School of Public Health and the Associate Editor of the Public Health Post. So join me in welcoming our panel and our moderator.
Hi, everybody. It's a real pleasure to be here. And I come at this conversation from a storytelling perspective. What Matthew Desmond does so beautifully and hauntingly in Evicted is to tell us about the lives, challenges, desires, and joys of people in Milwaukee living with housing insecurity. In Boston, we read stories in the news every day about the affordable housing crisis, rapid gentrification, and so much more. In our neighborhood here, where we sit at Boston University School of Public Health, we see the human faces of homelessness and trauma. Many of us sitting here in this place of great privilege also may feel the pinch of affordable housing and the fear that goes along with that. This conversation today is an opportunity to better understand the larger forces at work in Boston, what the city and so many dedicated people are doing at the policy, the community, the interpersonal, and the individual level. So the way that things are going to work is that our guests are each going to speak for about 5 minutes, and then I'll get the conversation started, and then we'll quickly turn it over to a conversation with you so that you can ask questions. And I'll just ask you now, and I'll remind you when we get started, that we were sort of billing this talk as a book discussion, but I would say that as you're thinking about your questions, think less about, what happened to Arlene and Crystal, on this specific day when this thing happened, and more in terms of questions that are inspired by those stories in the book and by what you're hearing from the panelists. So please join me in welcoming our guests. And Sheila Dillon is going to speak first, and she has some slides for us.
Can I use this?
I think you have a lot of
Oh, I'm on. Great. Thank you so much for having me. I'm going to give a Boston context on this issue. I'm really glad you read that book, though, because it has really that book has motivated a lot of policy here. So I just want to give a quick set the context. Boston's population is booming. We have a housing shortage. There's a lot of pressure on our rents and sales prices. We anticipate there's going to be over 700,000 people here in the year 2030. As I mentioned, our wages aren't keeping pace with the rising rents, once again because of our housing shortage. So we did put together a housing plan to build more housing in general, but also more affordable housing. Right now, there are 35,000 households in the city of Boston that are low income and extremely rent burdened. That means they're paying more than 50% of their income in rent. And that's a number that we are just very, very worried on, very, very focused on. But you'll see from our eviction data, which I'm going to get to in a quick sec, that most of the evictions are coming from that 61,000 number where people are low income and housed in affordable housing. It's a very interesting Boston trend. So we have a housing plan. We're trying to build a lot of additional housing units. We want to build additional 15,000 units of affordable housing added to our 55. We hope to have 70,000 units of affordable housing in the year 2030. It is not enough. So I'm going to say that up front, it is not enough. It's better than most cities. It's a very good percentage. It's 20% of our overall housing stock, but it's not enough. And we are limited by our resources. So skip over that. So until we build enough affordable housing, until we build enough housing in general, we know that people are getting evicted. We know they're in housing crisis. So 2 years ago now, the mayor established the Office of Housing Stability. Dominique Williams is here, Dominique, and she runs that office for us. I'm thrilled to see her walk in. And it has 3 functions. It does a lot of case management, 100 calls a week, roughly, where people are calling when they're really in distress. They either need to find affordable housing, they're being evicted, they don't know their rights, et cetera, et cetera. We also work with a whole network of good nonprofits, Greater Boston Legal Services, the Harvard Legal Aid, places that people that are helping with rent arrearages or mental health issues. So we get the calls. We know our network of nonprofits, and we're also making a lot of referrals on a weekly basis. Before that was very disorganized. Now it is very organized. We know who, and we're funding a lot of those nonprofits too to give them additional capacity. Thirdly, and I'm going to get to these numbers, we are starting to get good data on evictions here in Boston. And that's key if you guys know this. If you want to really have impactful policy, you have to have good data. So we're really looking at the data and we're saying, what changes in our system? What can we do to really cut down the amount of evictions in the city of Boston? Last year, a year and a half ago, we put forth a lot of legislation, right to counsel, Jim Brooks that would give tenants, let them know their rights, tenant right to purchase a building if it's being foreclosed on, rent credits to landlords if they rented below market rate rents. All of those died at the State House. We're going to refile a bunch of those bills this season again. But let's talk about the data. So it says 2016, but those are cases that we're looking at data in Boston's housing court. Now, that's where most of the eviction cases are heard. There are different, more what do you call them? Not an attorney, but there's other courts that do hear eviction cases, but the majority are brought forward in housing court. It says 2016, but these are cases that start in 2016 and go through 2017. So we're always a year behind. Now, one thing that's driving me and Matt Desmond and the folks at the city crazy is we can't get this data in real time. The courts refuse to give it to us. So we have to go in every year and we have to pull case by case by case to get the data and find out who's evicting, what kind of housing they're coming from, what neighborhoods, what street, what management companies, et cetera. But we are getting good information. We're in right now with our sea of interns pulling 2017 data looking back. So in 2016 cases, all cases, there were 4,600 eviction cases. The most interesting thing that we have found with this data is that the vast majority, 70%, are coming from subsidized housing. That is not what you read in eviction. That is a phenomena that's very unique to Boston, but we saw it as an opportunity, and I'll talk a little bit about that. In the private market, about 30%. So executed means that their case wasn't resolved, they weren't able to work out their situation. Executed means that they were asked to leave. Once again, the highest number is from subsidized housing. But as a percentage, it's lower in subsidized housing than it is in market rate housing. About 70% of families or households that are getting evicted for non-payment of rent. No big surprise there. The no faults, I would attribute the no faults to building clearouts. A lot of building clearouts these days as more buildings are condoed or owners change hands and want to do higher end renovations. This is also very telling, but it gave us data that we needed to put in place some funding sources. So people are getting evicted for very small amounts of back rent. You'll see that the executed cases in the subsidized housing, people are being evicted for $1,750. That's a very small sum that we were able to do something about. Now we are funding programs, and the state is funding programs for rent arrearages, and this is a godsend. So if you're a low-income family and you're behind $2,000, we can give you that and help you keep your tenancy. So that was just that information really helped us make the case for additional funding for rent arrearages. So I'm going to say that things are getting slightly better here. Now, I'm not here to say that the affordable housing isn't a crisis in Boston and that families aren't suffering. Please don't take it that way. But we are seeing some improvement since this office came into being, and we're putting more funding into programs. So from 2005 to 2016, there are a reduction in cases, eviction cases that are coming to court. And better than that, there is a reduction in the executions. So there are fewer households being evicted right now, and it's because we're intervening, because we're providing rent arrearage, and anyone who's coming into the city and asking us for money for new housing developments, any management company, they have to tell us what their eviction rates were last year and what they're doing as far as going forward. What is their plan to reduce evictions in their portfolio? So we're saying to our partners, for the first time ever, we know how many evictions you had last year. You're within the normal range, you're too high, we'd like to see this come down. And everybody's rather uncomfortable with this, but in a good way. They're saying, gosh, we are providing affordable housing and we're evicting. And all of a sudden we've got everybody's attention because they can't get new funding from us unless they're making some progress. So anyways, the numbers are better. Subsidized evictions were down 21% year over year. And if you looked at that number, it's rather cheap for us. It costs us about $2,000 to keep most families in their tenancy if they get behind in their rent. It's costing management companies between $5,000 and $8,000 to evict a family. So we're now making the case that it's better for them to work with us and keep the family in place than to pay that much money and have a family evicted. So what's next? We're just updated our housing plan. We want to work with our nonprofits and our for-profits and acquire more market rate apartment buildings and take those buildings out of the speculative market. So we want to do 1,000 of those units. We have put together an eviction prevention task force, management companies, owners, tenants, to really figure out best practices nationwide. We're doing some good things here. We're not doing everything. What else can we do? We even want to take this group and say, let's put a numerical goal on reducing evictions, which we've never done in Boston before. And we're going to craft a new legislative package, like I mentioned. And I think what we really need to focus on this year, although I don't have the mayor's permission yet, I haven't briefed him, but we did it 2 years ago, right to counsel. Only 7 to 9% of tenants go into housing court with a lawyer. We also need to track data on evictions, continue to build new affordable housing, and seek out best practices. Thanks. Sure.
Thank you so much. So we're going to go right down the line here, and we're going to hear from Johanna Flax now.
Thank you. I am on. Okay. It's really a pleasure and an honor to be on this particular panel with colleagues and contributors to trying to solve this problem that has been so well described in Matt Desmond's book. I'd like to begin by applauding the focus on right to counsel. So in Matt Desmond's book, one of the observations was that 90% of landlords are represented and 10% of tenants are, and that is conservatively more or less the rate in Boston. And that the consequence is illustrated, I think, very well by Arlene's story, where she just clams up because, show of hands, who's the best advocate when they're advocating for themselves? Not one hand goes up, and that includes me, right? And so to put people in that position goes, I think, very much against human nature. Medical legal partnership is a movement that was born here at Boston Medical Center about 25 years ago and focused on a small scale here in the pediatrics department on trying to equip pediatric patient families who had unmet health-related social needs with lawyers when those social needs have remedies at law. And many do, including housing and tenant rights. There's about 26,000 families in the Department of Pediatric Primary Care. At least that's the latest figure that I have. And when I joined about 11 years ago, there was one me, and there's still one me, and we had 4 appointments on Monday morning. So you can see we couldn't be maximally impactful. So under the leadership of our executive director, CEO, Samantha Morton, we have shifted to a much more upstream approach, which is to be working with colleagues in healthcare to design systems that identify problems early so that it's not at the stage where you need a lawyer to represent you because your case has gone to eviction. But, for example, taking the story of Lamar, the Vietnam veteran who lost his legs from frostbite, trying to help him get that dishonorable discharge turned around. Many of them can be, and then you can get certain kinds of benefits that help stabilize your income. Help him get Social Security disability income awarded, or Social Security income awarded. Still, in Milwaukee, when this was written, you could get a 2-bedroom apartment for about $600 a month. And I don't know why everybody's not laughing right now. So you really can't, on the kinds of benefits that even we could work out if we tried to get veterans benefits for Lamar and get his Social Security awarded, we couldn't get him an apartment in Boston unless he waited on a long list. So I'm going to use the remaining maybe 2 minutes I have to identify one other problem that goes beyond lack of counsel and lack of sufficient affordable housing to meet the need. Why we don't have the political will to make that happen. So I want to offer one quotation from Ben Jealous in his capacity as head of the NAACP. He says, in a democracy, there are only 2 types of power, organized people and organized money. Organized money only wins when people aren't organized. I think that's a very good crystallization. And when you look at the lives that the tenants in this book lead, there sure isn't a lot of time to organize around the systemic problems that are persisting in dehumanizing them. And I use the term dehumanize very deliberately. So I would identify the main challenge that we confront, and that's one thing we were asked to do, a main challenge that we confront in having success in our work at MLPB, which is to make it no longer the case, as public health leader Anthony Eaton, Dr. Anthony Eaton, and lawyer Anthony Eaton, and MPH Anthony Eaton says, which is that zip code will tell him much better than genetic code what someone's health future is. And so residential racial segregation, I would say, is our most persistent enemy in getting to a point where we're going to have adequate subsidized housing, deeply subsidized housing, for people who need it. And the reason is because the policy, in my opinion, around getting to a place of political will, where we're going to say, yes, we need this from a human rights perspective, is we need to see all people in our nation as equivalent as people. And it was sociologists who got us Brown v. Board of Education. It was sociologists who got us an end to school segregation in theory, not yet in practice. And it's sociologists like Matthew Desmond who are able to surface for us that persistent anti-Black racism that was written into our Constitution is continuing to organize people, but really organize Caucasian people to ally against their own interests. There is a stereotype of who the consumer of subsidized housing is and whether they are worthy of the basic fundamentals of being a human being, including a roof over your head. And I feel pretty strongly that as long as we are not living next door to each other, it's one thing to go to school together, maybe sometimes, often not, and then to go home to your own neighborhoods. But until we are living together, and we don't live together a lot, because by law we created segregated neighborhoods, and it has created a lot of the wealth gap that we see, we're not going to see each other really as equally human. And so I'm going to leave it there, but that's why I think we have the challenges that we have on getting a human right to housing.
Thank you, Johanna. So, Representative Rushing.
Thank you very much. I think that I got invited here because I've spent most of my career in the Massachusetts legislature working on issues of affordable housing, and especially housing being available and affordable to the extreme poor. So, and I belong to a generation that can remember when there was no such word as homeless and homelessness. But that's the population that I've spent a tremendous amount of time thinking about their relationship to public policy. But before I go into a discussion about that, I do want to begin with what was my halfway through this book, which I was asked by BU to read and then by Home Start to read. I hope we'll talk about Home Start if we haven't talked about, if you don't know about that. So I had to read it. And halfway through this book, I'm really getting annoyed. And I'm getting annoyed by this, just this sense of how this author is telling us all this stuff that no one knows, you see, all this stuff that nobody knows. And I was really getting annoyed until he finally had to admit what he was doing. Right? And he doesn't do it until page 295. And it's at the bottom. If you have the book, pull out 200. I'm going to read you the sentence, the key sentence that got me to finish the book. But he admits it. Until recently, this is a direct quote, until recently, we simply didn't know how immense this problem was or how serious the consequences unless we had suffered them ourselves. Unless we had suffered them ourselves. There's a fascinating sentence because the we's in that sentence have different definitions. See, the we simply didn't know is a different we than the we had suffered them ourselves. And the we who had suffered them ourselves have been suffering themselves for generations. For generations. And they don't write books. And if they did write books, and some of them did write books, we never read those books. Right? So the first we in here never talked to the second we in here. And this guy gets to go to Princeton because, right, okay? So I hope you're a little by it. You should be. When you read this stuff, be that way. And if you ever get to write this stuff, don't write it that way. This is important stuff. It's a great book. It tells us stories that lots of people don't know, but understand that there were whole bunches of people who know that now, knew it a generation ago, knew it before the Depression, during the Depression, and after the Depression. They knew this, and they were American citizens, like most of you. Okay? So we know how to do this. Don't leave this room thinking we don't know how to do this. We know how to do this. It's not just that half of our population who is the most advantaged and the most powerful and the most privileged. It's not just that they're racist and sexist and generally just don't like poor people. It's not just that. It is also that the profits from exploiting poor people are too high. It is too easy to make too much money keeping poor people poor. That's what this is all about. This could be over. This could be over in a generation. Over in a generation, rather than we looking at this, right, learning about this, right, after all of the suffering that all these people have endured all this time in this place to our advantage. To our advantage. What do I have? A minute?
You take as much as time as you want.
So Sheila and I go on the road a lot together, so she has heard all these stories. I did not get involved in doing a lot of public policy work around housing in the legislature, and especially around homelessness, until I was approached by a group of advocates. It was just sort of on my progressive list of things that I believed in. Right? And I was listening to them about the difficulty of getting housing for the extreme poor, and then went to a meeting of another group of advocates who were supposedly doing work and coming to us to tell us what needed to happen in order to house the extreme poor. And they had a list. I left that meeting deeply influenced by that list. Unfortunately, I don't know what I did with the list, but it was printed up it was on glossy paper. It was on glossy paper, and it had things like the need for more aid to help people who are addicted and people who are having mental problems, and it had about 7 points. 7 points of things that they wanted that the legislature to invest in, to change laws about, and not one of those 7 points was give them a house. Not one of those 7 points was give them a house. Now, a major shift has happened here in Massachusetts and in most parts of the country, and that most people who are working with extreme poor now believe that the most important thing to do first is supply the housing, and all the other stuff will follow. That shift, I do take credit for having a little piece in, making that shift in Massachusetts, because it is based on the fact that the problem is not those people's problem. Rich people who are crazy, honest to God, I know it's hard to believe, but most rich people who are crazy in the United States have homes. And they will tell you otherwise, but this is also true. Most rich people who are addicted have homes. Then if you are homeless, what do you need? A house. Who supplies that? And that is all the rest of us. We have to supply that housing. If there's anybody here who thinks people are poor because of something they do themselves, then they have never lived with poor people. Because when I grew up poor, I knew why we were poor. My mother told us why we were poor. We were poor for one reason. We had no money. People are homeless because they have no homes. And if we don't start there, we are in collusion with the rich and the powerful who want it that way in this society.
Thank you. Megan.
So thank you so much. It is really a pleasure to be here today. There is a risk to going fourth, all right? I will admit I was happy when I was fourth, because I was like, great, I get to hear the 3 people ahead of me, and then I can tailor, and the problem is I've changed what I was going to say 3 times. But it is, I think it's interesting. I don't know if you guys notice, I have 3 titles, right? So I'm not that I'm like, can't decide what title. It's that I really do think of housing and health as related in 3 different ways. So the first is I'm the Associate Director of the GROW Clinic at Boston Medical Center, and part of that is I take care of kids who are failure to thrive. And in many ways, the best things I do is listen to my patients. And oftentimes what ends up happening is that you think of failure to thrive as being a food issue. And what I'm here to tell you is actually is a housing issue. Because in many times when I have taken care of kids, right, and I'm tearing my hair out trying to get them to grow, right? I'm throwing shakes at them, and I have a nutritionist visit their house, and I do all these things. Most of the time when they start to grow, what do you think is the reason why they get to start to grow? They got off of a housing waiting list. And for me, it has been over and over this kind of eureka moment for me is that if the stable, affordable home is the prescription for good health, they don't stock that at the pharmacy of my hospital yet. We're getting there, and we're going to get there further and further. But to an extent, that ends up being what I want to do, is how do we start to make that connection between housing and health? I think we're making it much more. And I think to an extent, what Evicted has done is lifted up eviction as a public health crisis, right? 2.8 million people across the country each year potentially face eviction. But it doesn't necessarily get us always to the solutions. I have been interested in housing first when I came to Boston Medical Center as an intern, honestly more on quality. I started my career really focused on asthma and fixing people's houses, and I could tell the same story about admitting a kid with asthma and tearing my hair out until I realized that they got a cat. And why did they get the cat? Because of mice, and the family wasn't able to get the landlord to
get rid of the mice, so they got the cat. And I think that in many ways, quality still remains a really important issue. And the book really highlights that trade-off of quality and having just a roof over your head. I think that I've appreciated it more in my life around this idea of stability and affordability. So if quality was the first thing, it's not a healthy home if it's not stable or affordable either. And so the second title up there was Principal Investigator at Children's Health Watch. And I want to give a shout out to my Children's Health Watch colleagues. I see Stephanie Edger-DeCuba, our Executive Director. I see Allison Bovell-Ammon, our Deputy. I see Serlin Kantov in the back there. And so I think to an extent, there are ways in which we are trying to make the connection between hardships like food insecurity, housing insecurity, energy insecurity, making trade-offs or cost sacrifices, and the health and development of particularly young children. And so we've started to bring in eviction data and looking at if you've been evicted in the past 5 years, what does that mean for your health? And I think it just underlies the trauma of that event, that if just having an eviction in the last 5 years, you are much more likely to be fair or poor health. You're much more likely to have a history of depression. You're much more likely to be food insecure, 4 to 5-fold increased rates of food insecurity. And so it kind of underlies what I think the book says is, right, rent eats first. I think where it's gotten interesting for me is if it's quality, stability, affordability, what I've started to understand is that you can have this stable, decent, affordable home, but if it's not in a neighborhood of opportunity, you really have undermined what I sometimes will call like the housing vaccine, right? Like it has to be in a good neighborhood. And so in a lot of ways, both what Johanna and Representative Rushing talked about is we are still reaping I don't want to say the benefits, but the burden of redlining in our city and really across the country. And so as we start to think about it, our ability to change location, to be in the zip code improvement business, right? Because if zip code is more important to our health than genetic code, I'll say that health systems spend a lot of time talking about precision health, the way in which we're going to get you better health through your genetic code. And I don't understand why we don't talk more about zip code improvement in the same way. I will say, I think what's fascinating about it is that they'll spend hundreds of millions of dollars on it. And then when I say, well, why aren't we spending the similar amounts on zip code improvement, they'll say like, I don't know what to do, right? And I think that in a lot of ways, it underlies this idea of what's the economic model, right? Because right now there is an economic model in keeping the status quo. And in a lot of ways, I think as I've tried to understand location better, it's been interesting because what happens is that you try to plan to make a community better, and then what you hear is the market can't bear that. Like you can't find an economic model to make that work. And it's just made me think that like we need a new economic model. We need new economic players. And in many ways, I think that the hospitals and health insurers need to enter into changing economic models. Now, I may be a Pollyanna-ish around this, but I think that to an extent, if we are bearing the burden of that history in terms of the health outcomes on our patients, we have to change the systems that have produced them. We cannot be effective unless we change them. And that means applying our economic power as an anchor institution in these communities to make that change. And so I think that kind of the third hat I wear is trying to help Boston Medical Center have a housing initiative. Like, what are the ways in which we can start to think about being in the zip code improvement business, and then frankly lighting the way for other hospitals to follow. And I think that more and more, I really truly believe that we can make this so that it doesn't feel so strange. It feels like it should be in our core operating business, but how we make that a business model, I think is where we're gonna need a lot of help and where I think we can be most effective. Thanks.
Thank you, everyone, very much. Each one of you spoke about things that are very difficult, like structural racism, an economic model that is basically entrenches exploitation. Boston struggles with ongoing segregation. Yet each of you, in your own way, has optimism, spoken in an optimistic way. So I wanted, and Representative Rushing, you said this could be over in a generation. And I just wanted to ask a little bit more about that and ask, one of the things I think that a lot of us, when we're talking about this book, is that it's so difficult to read, and you almost want to stop. And you work and live this every day. So what's sort of the optimism that keeps you going? That, just maybe an example of one thing that you feel, okay, I'm feeling good about this. I do think maybe this can be over in a generation because. So anyone who wants to take that.
Well, let me start if I sounded too dreary at the beginning. So I am struck by the places that in our society we have thought it was appropriate to do good stuff for everybody. And I don't need to spend more time on those places and those successes, and see if we can use them as models for this problem. I think that for me, I always, when I think about what government can do, I think about public institutions, and my ideal public institution. Some people's it's open space and parks, but I'm a city person, and I never can get upset about concrete and asphalt. But the piece for me, my model institution, public institution, is a library. Libraries. It is an incredible idea because it is an idea that is not designed for any group of individuals. It's designed for everybody. We don't design libraries for certain people and not for other people. They're all open. And if you want to get a book, if you wanted to get this book, right, you could go to your library. Now, it is true that if you all went to the library to get this book, you might find that everybody's already taken all 35 copies that the library owns out. And you have a choice. You could wait, or if you have any money, you can just walk a block away and buy a book. Go buy the book. Right? But if you're rich or if you're poor, they're the exact same rules for getting a book out of the library. And everybody now, and I'll get back to a piece of this. It's interesting that we have another institution like that. Now, that institution, public institution, is going to be under a tremendous amount of criticism. They can have big pieces of them that don't do it as well as it should be done. But the other institution is public education. Public education. Now, imagine what would have happened if people had, in the United States, decided, let's do housing like we do public education. If you don't like this school that you're going to and you have enough money, send them off to St. Paul's or St. George's to get sexually exploited, right? That's okay. That's okay. Spend the money. Go do that, right? But it is available to everybody. Now, we should be always worried when people organize about stopping or dismissing public institutions. Now, there was an attempt to try to do that in the Depression under the Roosevelt administration, the New Deal, for housing. It was the first time it was ever thought about. And when people said, what do we do about all of the people who need to live in decent housing, we came up with this brilliant idea, still brilliant, public housing. Public housing. Now, unfortunately, we had a really strange ideology that was just out there in the United States. Survived, Roosevelt had to fight it all through the New Deal, and that is that communists were bad. And therefore, if communists were bad, anti-communism was a thing, right? And any kind of public investment, right, then became socialism. And socialism in the United States was always communism. There was no distinction made. And so you had an anti-communist movement. And so once, although they were able to do that housing, it never was built at the rate and to the extent it should have been built. But today, if we did not have public housing, no matter how terrible public housing got, generally, almost universally in this country, there was one thing about it that always stayed. We still owned it. The government kept owning it. And so in Boston, when public housing got to the state it didn't get to the state it did in places like St. Louis or Chicago. When people finally got around to fixing it up and saying, no, there's a better way that we can house these people, all the buildings were there and all the land was still there. Right? So in the United States now, so we decided in the 60s because this was too radical an idea, public housing, that we would invite the capitalists in. And that's why we have a voucher program. We have a voucher program so capitalists can make money off of poor people. Right? Just remember how it works. They lose no money. There is nothing, they contribute nothing to this, right? They lose no money. We pay the difference. Our tax money pays the difference. Right? We can do this. And I think we can do it as using these as models. I think we need to have we need to invest in a public investment in housing. We should be building this stuff. We shouldn't be talking about any kind of percentages. We should just build it till we're finished.
Thank you. So who wants to go next?
I'm optimistic. For folks that know me, I'm never that optimistic, but I'm optimistic that cities are getting smarter about how to really bring about change. I see it every day. We're working with academic institutions. We've got just these stables of very smart people looking at data. We're bringing the smartest people together. We're putting together just coalitions and effective service delivery systems. And so I've been doing this now for about over 20 years, and I have never seen groups work so well together using data as sort of the reason that we're doing certain things. So that's great. So I think cities are the place. I think we're really leading in some new ways of doing things, good ways of doing things. What I'm extremely pessimistic about, though, is the amount of funding that we're receiving from the federal government for all of this work. Housing is really expensive. Social services is expensive. Good health care is expensive. And our federal funding has taken, even when we have had a Democratic president, our federal funding has really decreased almost every year over year, especially when you take into consideration inflation. So I'm very optimistic. I'm very happy that we're figuring out almost out of necessity because we don't have federal resources coming to us. We're paying a lot in and we're not getting a whole lot back. So I think next time, and I say this to myself almost every day, next time we have a president who actually has a platform and cares, by golly, the housing activists have got to be more effective and start putting housing on the national agenda again. It hasn't been there, like Rep. Rushing, it hasn't been there since the 30s and 40s. So where have we all been? Why did we give the past administration a pass on this? So I'm optimistic that we'll next time around we will not miss this opportunity.
All right. Thank you.
I'll jump in. I think that in a lot of ways, I totally agree with both Rep. Rushing and Sheila on this idea of we do need to lift housing up in the conversation, right? There was a foundation started by a housing developer. His name is Ron Terwilliger, and he started this foundation for housing America's families, and he hosted an event in New Hampshire around the presidential election to get Republican candidates to a housing forum to talk about their positions on housing. And he actually got like 10 of them to show up. Granted, this was when there were so many of them, right? And so they came. It was painful how much they couldn't talk about housing at a housing forum. The questions from the audience weren't about housing. Like, it was one of those like amazing things. And so I ended up getting frustrated, and I was like, why can't we talk about housing? And part of it is I think we have to reframe how we talk about it. I actually don't think we should use the word housing. There's a really great report out there from the Frameworks Institute called You Don't Have to Live Here. And it's how, when we talk about housing, it's all the ways in which those messages backfire. Because when you talk to people about people not being able to afford their homes and all these things, they say, well, you don't have to live here. You can't afford to live here? You don't have to live here. And so I do think we need to change the conversation. We have to talk about it differently. It's why I end up using these medical analogies, right? Like a stable, affordable home is a prescription for good health. Because guess what? Health ends up as the thing people vote on in the top 3 always. And so how do you get people to say, yes, I want more health and I'm going to pay for more housing in my community as a way to do that? I think there is hopefully ways in which new sectors will show up to the conversation. Children's Health Watch is part of a coalition called Opportunity Starts at Home, which is really about trying to change the conversation and come up with a new agenda around making sure that we are going to get a lot more housing funding in the future. But I think we have to look to ourselves a bit about how do we talk about it. Because when you talk about housing, people think about units and it gets very kind of wonky really fast. I think we do need to tell stories in a much more empathetic light than a charity-oriented light. And I think we have to talk about systems, right? And that this is a system problem, so we need a systemic solution. And I do think we know how to do it. We just have never had the political will to do it. And so it's really about how do we get back into, honestly, like rejuvenating HUD. Realize that, like my sector, the health sector, right? The Department of Health and Human Services has a department called Health Resources and Services Administration, HRSA. HRSA's budget's alone bigger than HUD's budget. That's just one piece of HHS. And so we have to get out of this. We have to get into kind of reinvesting, and I agree, I think we need to build a lot more and really public housing, not just other housing.
I want to get back to this whole piece because I think that we really have to remember how much we talk about the fact that the government hasn't been spending money on housing. No, that's not true. It hasn't been spending money on housing for poor people.
That's right.
Right? The government has spent billions of dollars on housing for middle-class people and rich people. Yeah. We subsidize housing for rich people. Now, we haven't done that in a while in Boston, but just remember what urban renewal was, right? That was subsidizing housing, luxury housing. If you're not from Boston, and so don't know all the great stories about the West End, go read about the West End. I mean, in the West End, we spent federal money to tear down housing that poor people were living in, and then at a discount, sold the land to developers like Drucker and other people who've gone off to pretend to become philanthropists, right? And so that they could build luxury housing, that someone could put a sign on that said, if you lived here, you'd be home now. Remember that? Right? That was federal money. That was federal money. You know, in a sense, you know, probably, and I'll work on this for a few nights before my next panel, it really is like climate change. It really is like climate change. That you can keep ignoring this. You can make up stories. You can make up myths about this. And we are living mostly in policy based on myths about poor people. You can make up myths, but it's gonna come and bite you in the ass. Right? And you do not know when that will happen.
Wow. So Johanna, do you want to jump
Just
in
make
now?
sure you're living in the right neighborhood.
So I am trying to be a responsible optimist, and it's hard right now. I just want to acknowledge that because we've been given a lot of reasons, if our eyes are open, to not be optimistic. I do think that the candor recently about the mortgage subsidy that, I mean, let me just be transparent. I enjoy it. I am enjoying my tax deduction because it is allowing me to live in Milton, where the schools are pretty good, and it has a quality that only, I hear, 4 neighborhoods in the Commonwealth have, which is that if you are a family of African descent and you would like to live somewhere where maybe 30% of the African descent population is at the median income for the state, and maybe 30% have some level of higher education, and the schools are good, you have 4 places. This goes to your point about opportunity. And if you are Caucasian, you have 500 and something. Now, what gives me optimism, so again, 500 and something. What gives me optimism is that we're seeing some attention being paid to this. I think, and this, you know, maybe I'm just being too optimistic. I think 10 years ago, when I actually sat in Representative Rushing's office, having just started this job, and the state auditor had come out with a report saying there's 81,000 people on the wait list for Section 8, and there's not enough affordable housing. And I said, okay, well, what about all the other affordable housing? Because it's incredibly complicated. I don't know if everybody knows that. And this is like a legal structure. It doesn't have to be that complicated. Representative Rushing will say this much better than I can, but it is a legal design that profits people to have, you know, hundreds of different affordable housing programs. So if you're on the Section 8 wait list, that doesn't mean that you're on the project-based Section 8 wait list, or the low-income housing tax credit wait list, or the public housing wait list. And there's endless wait lists you could be on. Some attention has come to this recently, and there's now at least a universal Section 8 wait list. Because if we come back to the book, there's an example, I don't know if anyone remembers, a little story about Jory's cat. Does anyone remember Arlene's family? They have a cat. There's this little story where, if I can make a reference to a local movie, somebody give me the title. It was the one where the Simpsons episode said, the rat symbolizes obviousness. I don't know if anyone remembers that, but in this book, the cat and mouse description, clearly to me, unless I'm just reading into it, of this cat that is just playing with this mouse, tossing it up in the air, watching it scurry away, chasing back after it, rent recertification hearing, that's what I would call it, tossing it back up in the air, seeing how it does, and then we wonder why eventually the mouse is exhausted and gives up. Well, part of it is this system that we've designed, and if you're lucky enough to have an advocate, and healthcare is working on trying to get people some advocates to help wade through this morass, then maybe you can sustain and get to the point where your name comes up on the list, or maybe they can tell you when you're 19, like, I'm going to forget the character's name, don't give up that public housing unit, because you won't just get another one. If you're lucky enough to have that, maybe you can get back up again. But we're seeing some smart things happening. Like, why don't we not make everybody have to chase down every single Section 8 wait list across the state? Let's have one universal one. Good idea. So that's a start, but I do think whether we call it, and there's so much debate on this, whether there should be vouchers that are regulated and you can't profit as exorbitantly as people do, because it's regulated, because it's not just any kind of good. It's not a widget. It's people's homes. It's people's lives. Whether it's building public housing, which everybody wants now in Boston. This is a news flash, because you can't get a unit of housing that you can afford the way the rent standards are with Section 8 now. They don't align with what's on the market. Whichever it is, we've got to get to the point where there's enough for everyone, and we need to believe that everyone deserves it, and that's where I started. I'm not sure we're there yet on that. We're talking about it.
Thank you, everybody. So why don't we turn it over and give people in the audience a chance to ask questions, make comments, jump into the conversation. So yeah, when you please stand up. One of you can decide which one is going to go first. There's a microphone, and if you could just introduce yourself and let us know if you're a student or on the staff. I know you're a student, but not everybody else does. And or if you're a guest from somewhere else, then we can all get to know each other a little bit.
Great, thank you. Wow, my voice is strange. Luke Figueredo-Miller, I'm a student, and I also had the pleasure of working at the Department of Neighborhood Development this summer. So my question is trying to dive in, well, it's a kind of two different questions, I'm sorry. But it's trying to dive into like, what does the partnership between housing and health look like tangibly? Because I think public health is really good about talking about the social determinants, but when it comes to, we love to bring up silos, but when it actually comes to figuring out how do we bring BMC and D&D together, what does that look like? And then the second one is, Sheila, you mentioned earlier about the legislative agenda. I think one thing that would have been, or at least I'm curious as to last year, a lot of the failings for some of the bills that we pushed forward. I'm curious about how much support y'all got from the medical field, and how it would look like for this year when you push forward the agenda again, like how would we partner with the BMC, partners in healthcare, things like that. Thanks.
So I guess people can hear me. We learned a lot, I think, in the last legislative season. Coalitions come together when groups want additional money from the state. That is not necessarily the case when we're putting forth legislation that will protect households. So my big wake-up moment after all the bills failed is that we didn't have the right coalition. We had a lot of housing activists, but we didn't have the health sector. We didn't have the more mainstream housing folks. We didn't have the developers. We didn't build a coalition. And right now, having learned from the last session's failures, I'm actually calling groups saying, what are your priorities? What are your priorities this time? And I don't think we should move forward unless we have a broad-based coalition that includes lots of different sectors on legislation. Now, oftentimes they're competing. So if we say right to counsel, every especially poor family going into court should be legally represented. Even affordable housing developers and owners are like, do I really want that? So some do, some don't. So I think we shouldn't move 2 steps without making sure that we've got broad-based coalition this time, and put a little pressure on folks too that have been benefiting from the affordable housing industry to make sure that they're helping us, really make sure that evictions are reduced. So I absolutely agree with you, and I think that I learned a lot in the last couple of years. I do think that we're a pretty fractured group. We've got affordable housing developers. We've got a lot of people that do finance. We get tax credit syndicators. We've got advocates. We've got Home Start that's helping people stay in their homes. And it's sort of it's a very fractured system, and I think we really need to spend more time together in really developing coalitions, especially as we work with the federal government. One thing about how we're working or not working with our health partners, or I would say systems of care. Right now, one of the probably the biggest feeders coming into our homeless system are psychiatric hospitals discharging, systems of correction, a lot of, so we're starting to see, as people come into the homeless shelters, where are they coming from? And oftentimes they are from well-meaning systems of care, and we've absolutely have to change that. We need to be a seamless system. So if people are showing up and they need housing, how is that information coming back to people that are working on housing search to make sure that those people are assisted? And if they are entering our homeless system because they're being discharged without the proper supports, we need to correct that discharge planning. So I think it's broken right now, and I'm glad you raised it, and I think there's a lot of work to do.
Thank you. So another question? I'm going to go to the other side of the room. Sorry. So yeah, over here.
Hello, my name's Jeanette. I'm a planner at the Metropolitan Area Planning Council. Something that I've been thinking a lot about since I read the book is the power to use people's eviction history to exclude them from future housing opportunities. I haven't heard much about that in local policy and advocacy circles, and wanted to know if you've seen this in your data and your research, if there's any work ongoing on that.
I'm happy to answer with a not happy answer, which is that there's actually services provided to landlords to scour the public records to see if people's names show up and to hold that against people. And there's a movement in legal services to cabin off who can actually access this information and use it against people, because part of the problem is that the mere fact that someone has been the subject of an eviction proceeding does not mean that they have ever done anything wrong as a tenant. And you can think of examples in the book where someone's not behind in rent, but they call in about an egregious plumbing problem that would offend even 19th century public health standards, and they are served an eviction notice. And so if they were to go to court about that, and it were to, if the case were to go to court, I don't even mean if the individual were to go to court, if the case were to show up in court, their name would be on that list, and they would forever have a blemish on their record that a landlord, without being considered to be discriminating illegally, could use against them. So there's work to be done, and there is a community of legal services leaders who are focused on trying to cabin that off and not make this public record available to be used in a discriminatory way. At the same time, sometimes, as I forget the percentage, but there was a very high percentage of individuals in this book who were facing housing instability because they could not afford the rent. And when you are evicted because you couldn't afford the rent, again, your landlord can use that against you. And a lot of the book was about how some landlords, and this is the self-perpetuating part of the problem, are happy to find the tenant who is desperate, because then they can rent the unit and get some short money for as long as they can while the plumbing still doesn't work. So again, it's being treated like any other good or service or widget, and not like something central to health.
Okay. Yeah, in the back here, in the blue sweater. Yeah.
Hi, my name is Kit Mitchell. I'm a fellow with the Boston Healthcare for the Homeless program. And mostly what I'm wondering, coming from this perspective of working with primarily older adults who have previously experienced or are currently experiencing homelessness, is that being housed can be incredibly destabilizing because you're moving from this neighborhood that you might know really well and this community that you have ties in to somewhere where you probably don't necessarily know anybody. And I'm wondering what kinds of post-housing support services are being talked about as we plan to try and build more affordable housing in the city of Boston.
So most,
That's right. You go, and I just want to follow on it because I think especially as we think about homelessness, we tend to talk about it monolithically. So I just want to make sure to kind of.
So the effort in Boston right now is to house individuals that have been homeless the longest, as you probably know, working at the Boston Public Health Commission. And when we house, we actually have one thing we've done really well is to use resources coming from Mass Health to pay for support services for a year or two. And that has been a game changer because even if you can find the money for the housing, oftentimes the support services are lacking. So that's in place. But what we have noticed is people that have been housed after they've been homeless for long periods of time, there's a certain percentage, will find themselves back on the street or in shelter because they don't have any kind of social supports. They're put in a unit, they're isolated. So we now are thinking, okay, who out there, and we're sort of looking at philanthropy and sort of churches and things, who can bring people together and start actually very intentionally making community with those folks that have been housed.
No, I think it's just a really good point. I mean, I think Boston Healthcare for the Homeless and BMC are in the same Medicaid ACO, right? And so for those that aren't familiar, how we get paid by Mass Health, by the state Medicaid is different now. We used to get really almost a fee for service, right? The more times you got sick and you came to see us, we charged a fee and we got paid more. And so now we're getting paid differently. We're getting paid a capitated rate. And in fact, Mass Health knows that homelessness is a bad risk factor. And so they're actually giving us more money to take care of homeless individuals. It's not enough to pay rent, right? So then what are we going to do? And I think I have started, I am a pediatrician, so I am not an internist. I did have the pleasure of working at Healthcare for the Homeless for about 6 years on the family team. So I have a little bit of insight into it, but I think adult homelessness as its entity, I think of now more and more as falling into kind of 3 groups. There is a group that is pretty much has a couple of chronic diseases, they're very sick. They're homeless or housing unstable, because I think we have to call out the couch surfing group, right? The group that goes from family member to girlfriend to person from their church. And they come to our hospital a lot. They may come once a month. The house officers know this person by name. Everyone who went through a residency program knows Mr. Smith, right? But not that complicated socially, right? May not have a substance use disorder, doesn't have a mental illness, just needs a home, right? Then there's a segment of people that do have substance use disorder. They're going to need a certain type of housing, and I'll be honest, it's going to be harder to get them into that housing because of their substance use disorder. So now we need to think through what are their housing options. And then there are people with really, what I sometimes now call a kind of trifecta. They have a serious mental illness, they have a substance use disorder, and they have a chronic disease. And unfortunately, I think what happens right now is we are not designing supportive housing for any of those entities, right? We're kind of applying a bit of a one-size-fits-all approach, and I do think that particularly, on the one hand, we have made great strides around supportive housing. Again, Mass Health pays for C-SPEC, right? Community Services for Person Experiencing Chronic Homelessness. Like, I go to other parts of the country and they're like, say what? Like, they do what? So like, we're very blessed, and yet, what we're somewhat stuck with right now is when a unit comes open, we place the person who's at the top of the list, and that may not be the right fit. And so how do we think about developing new housing, because we need new housing, and how do we design it with social networks in mind so that people don't stare at the walls of their unit and feel really isolated? And I think there are ways to get there. I think we should help finance that from our end of the spectrum. And I think we can make a business model on that. I think where it's going to get honestly titchy, and I'm going to just throw it out there, is we are going to want to finance that, and then we're going to want to place our patients there. And there's this thing called fair housing that is going to make that somewhat hard. And I think there are ways around it. So that's my optimism side of it. I think there are ways around that where I think we can make it work, and I think we have to, because right now it's crazy town what we're doing, where people coming in once a month basically because they're homeless instead of being sick, and I think there are ways to solve that.
Yes, please.
I have a question pretty much on that subject.
Can you tell us who you are, please?
I'm a staff member at the university. So my question is, do we have enough information about BMC's housing program to be able to say how well it's working? It does seem like exactly the kind of program that you're describing, one where people would be housed in their communities.
So, and I should have made this clear when I first introduced the subject. So, all right, so Boston Medical Center has put $6.5 million into a housing initiative. So first question is, you're like, where'd you get $6.5 million? So the issue is that in Massachusetts, we have a program called determination of need. When we put up new towers, we have to justify the new tower based on basically have a percentage of it, do a community health initiative based on a determined need. So what's interesting is BMC went to the Department of Public Health that manages this process, and we said, we think affordable housing is the most pressing need in our community. We want to use all of the money towards a housing initiative, and we were really lucky, and they said yes. The second piece I want to emphasize, though, is BMC is not building and operating its own housing. Like, we believe partnership is the model. So to get back to the partnership question, we really believe that we are investing in the housing community as a way to bolster their ability to address social determinants and to hopefully create some new housing. So there are kind of 9 partnerships. I don't want to get into too much. I will just call out, just because Dr. Elmer Freeman is in the audience from Cheers, is that part of our investment was not just in housing, but in this idea of economic development, because sometimes the way to a stable home is a better job. And so part of our thinking is to try and think about housing and economic development together. One piece has been, we have tried to build into our partnerships this idea of access to housing. So I also want to give a shout out to Boston Housing Authority, John Kane's in the audience, is we have tried to create housing partnerships where we say, what's our pain point? Our pain point is access to housing for our high-cost, high-need patients. What's your pain point? Oh, your pain point is that you don't have money to actually do upgrades for, you approve the reasonable accommodation request and then you can't actually put the walk-in shower in. Let's create a reasonable accommodation fund for you. So trying to find that mutually shared pain points. I think we're early, but just to give you an example of one of our kind of early success stories is we had somebody who had 8 hospitalizations in a year for congestive heart failure. That person is now in Boston Housing Authority, and over the same time period, he's had 1. So you went from $1 million patient to a $100,000 patient. I just paid for a lot of the program out of that. And so I think within, unfortunately, the healthcare world, we have what are called kind of the super users, the high-cost, high-need patients. For us, it's the top 3% use 40% of the dollars. And when we look at those top 3%, 40 to 50% are homeless or housing unstable. And so it's not that hard to say, like, why are we doing a housing initiative? Because we can't afford not to. Now, here's the thing. We don't want to just do housing for our high-cost, high-need patients and do nothing for the pipeline of people that are coming, right? That's like tertiary prevention with no secondary or primary prevention. That's crazy, right? So you have to build the economic model on not only the high-cost, high-need, but building more affordable housing for the people who are in the pipeline to become those high-cost, high-need patients. And you have to stack that population health and community health economic model together.
So I'll come back. You've been very patient. Right.
Hi, my name is Jesse Dubin, and I'm a student at School of Public Health. And so it's great that you ended that way, because I think this kind of ties into what I'm going to ask about, because you keep on mentioning zip code improvement and the business of zip code improvement, and that we don't have one, but I want to respectfully disagree that I think there is a business of zip code improvement, and it ends in gentrification. So, because we often hear like, oh, gentrification, it improves the economy of the area, it improves the zip code, it improves these things. So like that is happening. So how do we go about our advocacy for zip code improvement very well-meaning and stop it before it becomes pushing people out? How do we make sure that it improves while keeping people there?
Yeah. No, I'm going to jump in, and I'm sure other people will. So what I say is gentrification is not the dirty word, right? Displacement's the dirty word. So it's, or maybe dirty is not quite the right term, but it's this idea that, like, to an extent, that, you know, these neighborhoods were systematically disinvested in. And so gentrification is the marker of new investment. So that's what we need. We just need to make sure that people who have suffered through all the decades of disinvestment get to benefit from the new investment. I think where it gets hard is I don't know of many places that have pulled off gentrification without displacement. So that's what I mean by that model of zip code improvement is you're right. Like, I mean, it's interesting, like Boston Medical Center has embraced this kind of vision of, you know, making Boston the healthiest urban population by 2030. The problem is you can do that by moving out a bunch of people, right? Mm-hmm. Or you can do it by your patients being able to stay and improving the neighborhoods around them. And we're trying to opt into the second choice. But it is, I think, the hard part is it requires a lot of resources. And again, BMC is not going to solve this alone. It is really how do we bring other, honestly, hospitals, health systems, educational institutions to the table with a great city and state government to try to align resources better, and then show that it's worthwhile from an economic model perspective. Because I do think right now we do have a current model. We just have a current model where we're keeping people in poverty instead of taking them out of it.
So I think this is probably a good question to end with. Maybe each of you could chime in if you have some thoughts about whether or not gentrification is the dirty word, that's a good distinction.
I spent my whole political career representing the first and biggest gentrified neighborhood in Boston. I mean, there are worse things than gentrification. The West End is an example of something worse than gentrification, where you just tear everything down and no one comes back. But I think the points you make are really key, and that is, can you develop neighborhoods? Can you make neighborhoods better without displacing anybody? And yes, if you thought those people were important.
That's right. Yeah.
And so you have to start out with saying the people who are living in this geography, no matter how poor they are important people. And so then you design a program around that. There was there was a significant amount of vacant housing in the South End. Vacant housing, not rooming houses that got taken over. I mean vacant housing, right, in the South End when gentrification began. Now, if you are into then making the neighborhood nicer, you could say that the only place you can come into is to vacant housing. And of course, gentrification, of course, it has layers, right? And there were people, I can remember cocktail parties with what they were called urban pioneers, and they would diss their neighbors who had just come in if they bought a rooming house. You see, that was, no, my house, it was vacant when I bought it, right? So that was okay, right? And then, of course, people decide, oh, forget all of this, we'll just make money off of this. Right? And now, in order to do that, it means that you have to make sure that that no one gets a benefit for being rich. Right? And so, and no one wants to do this. That's the only reason why Roxbury is not totally gentrified is because white people don't like black people and they don't even want to live a year on the block with them, right? Yeah. And so, but if they think that they can live a year, if they get past that year, they'll buy, right? So if right now we have integrated. We've always had integrated parts of Roxbury, and so now the real estate agents say that they have this wonderful house. This is how much it costs, and it's in walking distance of Fort Hill. It's not on Fort Hill, but it's in walking distance of Fort Hill, which means we think.
Yeah.
Right? Now, if you want to, so then what are the kinds of economic things that benefit rich people, right? And one of the things is condos. Condos benefit rich people. Zone out condos. If you want to end gentrification, zone out condos. Essentially, you have to zone out making lots of money. Now, there'll be a few people who have lived in that neighborhood for a long time who are not going to be happy with you. They have owned their house for a generation, right? The mother is on the verge of death, right? The kids came. You're nuts to stay in this house any longer. Come on, sell the house, right? My brother lives in a neighborhood in Queens, in Brooklyn, that several years ago decided that the houses were too big to be profitable for most developers, right? So they zoned it to be single family only. And there are a lot of people who said, you're nuts, you're zoning poor people out. They said, there's not a poor neighborhood, there's a low middle class neighborhood, and we just don't want it all bought up to be made into condos, right? So many, they had so many people knocking on their doors, right, to buy their houses, that after they got the zoning changed, they actually put that zoning article on a regular kind of metal panel and put it on every block, right? So when you walk down the street, you knew where you were. Now people cheat and all that kind of stuff, but my point here is, who are the most important people at that particular time? And if the most important people at that particular time are the people who live there, there will be lots of space for rich people. And you can do it without displacement. You know, it's interesting and it works the other way around. We have, in the South End, because we had at least enough organizing going on in the South End at the beginning of gentrification, that you were able to have a considerable amount of permanent affordable housing. I just got this sort of back-end compliment about the South End. Someone has written a book where it says the South End has more affordable housing than any other gentrified neighborhood in America. Right? So, but one of the things we did was we did not take out public housing. And so right now, you can live in literally a $6 million house, because now we have gentrification is passe. I'm sorry, condos are passe. We are rich enough in America that people come in, buy all the condos in one house, and remodel the house to make it one family again. And then when you net that out, it comes out to be about $6 million bucks. And so we have people living in those houses, and they literally live 3 blocks away from what was Cathedral Housing Project. All right? Now, if you wanted to do it the other way around in the neighborhood that they came from, can you imagine? They're living 3 blocks away from public housing. Can you imagine going out to Winchester and saying, we just want to do this public housing, and we can prove to you that your real estate values are not going to go down, right? Now, what's important? What's important? We have to define who are the people who are important and make the public policy around them.
Thank you. So, Johanna and Sheila, we have maybe take a minute each to give us your thoughts about this. Sorry.
That's okay. No, it's a really important issue, and every single neighborhood right now in Boston is so desirable. So I think, we are, to be realist, because that's my job, we have to continue to build a lot of affordable housing for a range of incomes, and we need to make sure we don't lose, to the rep's point, 1 unit of public or existing affordable housing right now. So that's just, and we got to make sure we're working with the state right now to for them to allow us, because they put funding into our affordable housing projects, that if there's a new unit of affordable housing that's coming online, that we can't target a neighborhood, but I'm asking them to allow us to target or give preference to families or households that are low income and rent burdened. Because we've got to be more intentional. If it costs $400,000 to build a new unit of affordable housing, we've got to make sure that when it comes online, that somebody in Boston that's really negatively impacted is going to get that resource. So I don't think we're going to stop gentrification, but I think, we're going to have 70,000 units of affordable housing. We need to go beyond that, and we need to create enough housing so that everybody is here that can stay. One final thought. The reason that we have so much housing pressure in Boston is because we don't have, our transportation systems aren't good enough, okay? And surrounding communities aren't building any affordable housing. None. Zippo. And I'm always struck by the amount of pressure and the amount of dialogue about Boston, which is really important, keep the pressure on. But the surrounding towns haven't even met their 10%. They're not building any affordable housing, and they fight it vociferously. So I think it's great that we continue to look at Boston, but if we had a region where the region's housing stock was 20% affordable and there was good transit, that would be the ideal, and then we wouldn't feel the acute pressure that we have in Boston now.
Thanks, Johanna.
Well, I am always happy to yield to Rep. Rushing, who said much of what I would have liked to say and what I attempted to say at the beginning about residential racial segregation and how it perpetuates our public policy, continuing to not say that the stereotype of the public housing consumer is an important person, is an equal person. There are any number of public policies that have been tried and true that help prevent displacement in circumstances of gentrification. And one is considered a dirty word that you're only supposed to whisper, which is rent control. Okay, but the reason why people would think about rent control is because they would think that people who are low income and disproportionately people of color, but by no means majority people of color, are worth protecting and investing in. And so one of the things that I think this book is great at doing, at least for me, not without some sort of, I have subtle concerns about some of the descriptions, but mostly it's humanizing and undermines an image of poor being undeserving poor. I think the final thing I would like to say is that you're not hearing from people who at this moment in time, if I may be so presumptuous, are themselves poor. We may not be rich, but we're not hearing from poor people. And there's someone in this room that I think public health should know about who is creating a space for people who live in the communities of Dorchester, Roxbury, and Mattapan to be leaders in thinking about their own lives and organizing in the way that the cat and mouse story that's described here really makes very hard. And that's Dr. Renee Boynton-Jarrett of the Vital Village Network, who's in the way, way back, who has created a community engagement network. And if you're in public health, you may want to know her and hear from her constituents.
Well, thank you so much. This has been really wonderful. We have some refreshments here, I think, and some opportunity for you to continue the conversation. And I just wanted to also let you know, I don't think I said this at the beginning, Matthew Desmond will be here on campus. He'll be over speaking at the Narrative Conference at the College of Communication in late March, so we'll be sure to let you know when that's going to be happening. Please join me in thanking our wonderful guests.